normative thinking about the lives of people with disability could affect the very basic action or inaction that a doctor would take. One thing that people will sometimes say to me, and they think that they're giving me a compliment, they'll say, "Lisa, we never think of you as disabled." You know, it just kind of always gets to me when people think that that's a compliment. I'm a person who loves color, and it's just really important to me. I love vibrant color. But I remember my 4 years at medical school in shades of gray. Harvard would have these dinners, and I sat at a table where to my right was a very tall man who was the CEO at a major academic medical center. And I decided I was just going to describe my story to him and say, look, I know that I might not be able to do a full-time internship and residency because of my multiple sclerosis, but could I maybe do a part-time? And he kind of steepled his fingers and he paused for a second. And then he said, well, there are too many doctors in the country right now for us to worry about training a handicapped physician. If that means that some people get left by the wayside, so be it. I was unable to go on to train to become a practicing doctor. The medical school refused to write a letter of recommendation for me. Once I graduated from medical school, just like I realized that now I needed to kind of take control and move into a different space. I started interviewing people with disabilities, and I remember a woman saying, you know, she'd never had a pap test because no doctor ever got her out of her wheelchair to get her onto an examining table. And so it just made sense for cancer to be a place where I would focus. And by now, I've probably interviewed over 300 people with disabilities. I was fortunate enough to get funding to do a national survey of physicians and their experiences with and perceptions of caring for people with disabilities. And so our results were a little bit troubling. We found that 82% of doctors say that people with significant disability have worse quality of life than other people do. That's not a good thing. One of the earliest pieces of research that I did was to find that women with mobility disability were 70% less likely to be asked about contraception because doctors, you know, don't think that women with disability are sexually active and therefore at risk of having human papillomavirus. So they may not think it's necessary to test them for cervical cancer. Only 41% of physicians feel strongly confident that they can provide equal quality of care to patients with disabilities as they can provide to other patients. And when I present that statistic to a group of doctors, they do kind of acknowledge that they weren't trained about how to care for people with disabilities. There was a man who I interviewed who had a spinal cord injury. And because the doctor never got him out of his wheelchair to examine him, couldn't do an adequate exam of lymph nodes in the groin. And by the time he was finally diagnosed, he had lymph nodes the size of a grapefruit, you know, and so obviously that was going to be at a more advanced stage than it would have been otherwise. There are some disabilities that are profoundly painful and where the lives of the people living those disabilities are very much affected and where their quality of life is impacted. But for the rest of us, you know, I've had MS for 45 years People with disabilities, we figure out how to adapt to our lives. And everybody, regardless of whether they have a disability or not, has things that are good about their lives and things that aren't good about their lives. And so focusing only on the disability is, I think, a very discriminatory attitude. I'm not completely past what I experienced. I told you I saw my world of medical school in shades of gray. I wouldn't necessarily say it's like vivid color yet. In the day-to-day lived experience of people with disabilities, we still don't have a kind of society that is not ableist. But the palette has brightened. One of the solutions is when the doctor allows the patient to be an equal expert with them in thinking about their care, and they do a collaborative kind of partnership in coming up with a therapeutic plan. My research on disability isn't what I set out to do in my life, but it has been profoundly rewarding because it has given me a chance to talk to these more than 300 people that I've talked to and bring voice to people who typically haven't had a voice in our public. That's where at the end of the day I feel that I was very privileged in my career.